Hi, it's Crystal with birthingunconsciouschoice.com. Today I want to talk a little bit about cervical checks. Most women have them at various times during pregnancy, sometimes at every prenatal appointment. And I want to question why we need them and what information do they really give us, and is it helpful? A cervical check can give information about whether your cervix is high or low, whether you're dilating or effacing, whether the cervix is getting shorter and or the opening is expanding. However, even during active labor, there are other ways to assess progress, and so I make a case that cervical checks are unnecessary. You can get through pregnancy, you can get through all of your labor without ever having done a cervical check. Because sometimes the information that they provide doesn't really tell you anything, but it can serve to stress you out, to unnecessarily worry you, to color your perceptions of what's possible or what's actually happening when your cervix can change very rapidly under the right conditions. And I'm talking, 5-6 centimeter change in less than an hour under the right conditions. But people get so hung up on, I'm only 1 centimeter dilated, or, well, I'm not in active labor until it's a 4. None of that is really true, especially with women like me who have had more than, the typical 1 to 2 babies. It's pretty common to have your cervix start dilating well before you're in active labor. There's a textbook definition of active labor, which is you have to be 4 centimeters before you're considered to be in active labor. And then if you go into your typical care provider and you are 4 centimeters, especially in a hospital setting, they will admit you and they will say, okay, you're in labor now. So if your labor decides to stall out, then they're going to say, oh, it's failure to progress, or they're going to want to do other things to get labor started again artificially, which I don't think is fair, because 4 is a guideline as to when active labor has begun. But I walked around the last 3 pregnancies dilated to a 6 and almost a 7 for about a week each time. And the first time that happened to me, it made me a crazy person. I knew that I was dilated. I should be in active labor. What's wrong with my body? What's going on? I'm so frustrated. Any minute now, the baby will just fall out. I was worried. I was scared. I was confused. I think looking back, having that knowledge of, oh, I'm dilated to a 6, didn't do any good. It stressed me out. It made me more panicky about, why isn't my body doing what it's supposed to be doing? 6 means active labor. I got so caught up in the definitions of what was supposed to happen that I didn't leave room for the possibility that maybe my body did know what it was doing and I just needed to relax and let it happen. It's perfectly normal to be dilated quite a lot for a long time before labor. It is also equally very normal to be not dilating or effacing at all until labor actually begins and your water breaks. Like I said, the cervix is very capable of changing rapidly. I'm talking rapidly. So under the right conditions, your cervix can do whatever it needs to do to make a passageway for your baby to come out. And getting hung up on the numbers and the timing, I've seen it hinder so many women. For instance, I remember years ago, a good friend of mine, she felt like labor was just never going to start, and she kept getting her cervix checked, and she was always at a 1 or a 2. And I think it really cemented in her mind that, oh, well, if I'm already at a 2, labor should start soon. And then a month later, she was still at a 2. And I think every moment, every day, every week of that month that went by, she was reinforcing a belief in her head: my body isn't doing anything. My cervix isn't capable of change. I'm not going to be able to do this thing. She could have saved herself so much worry, stress, and fear. And it makes me sad to think about maybe she had, reinforced some negative beliefs about her body not being capable. All because, she was getting this information that maybe wasn't even necessary or useful. So you don't, even when it's the protocol, even when they say, you're going to, a large impersonal hospital, and they say, go ahead, go in that room, take off your pants, change into a gown. You don't have to. You just don't. Nobody can tell you what you can and cannot have done to your own body. So there's no reason to feel that you have to do cervical exams. There is a really excellent article talking about the psychological impact of cervical exams on the power imbalance with a lot of medical professionals, especially male doctors and female patients. There's already a bit of an imbalance there, which sadly but true. But the whole power over of, you lay down, change out of your clothes, and I'm going to put my hand where no one else's hands usually go. And it can be psychologically very damaging over time to women. And it's just not necessary. And I do think that is an unconscious or possibly a side effect, but it does actively perpetuate the kind of relationship that some doctors want with their patients. There's doctors out there, sadly, who they don't want a partnership with pregnant women. They don't want to read your birth plan. They don't care about, what you read on the internet or any, peer-reviewed journals that you've come across about vaccines or breastfeeding or, active trials of labor in VBAC clients. They're just not interested, sadly enough. And that there is a power imbalance that I think we have to be watchful for as women, advocating for ourselves in a largely male-dominated medical setting. And the cervical exam it does play a role, both psychologically on yourself and psychologically in a larger scale as far as that dominant submission relationship, where I'm the doctor, you're the patient, you do what I'm told. No, it doesn't have to be that way. It just doesn't. And if you have a care provider that refuses to treat you with respect, that refuses to, acknowledge your concerns and repeatedly talks down to you, 39 weeks is not too late to find another care provider. Might be difficult, might be, upon dire warnings, but it's not impossible. So, please rethink the cervical exam.